The first graph I'm going to show you is our epidemiologic curve of confirmed cases over time. And you can see that the number of cases per day steadily increased starting in early September, and that lasted throughout most of October. But what's very concerning to me about this particular graph is that there has been an accelerated growth in cases during the past 2 weeks. As you can see that the slope of this line has changed. And these past 2 weeks don't even yet represent complete data. So at this point in time, we have the highest number of cases that we've ever had, and our case counts are accelerating. So unfortunately, this accelerated growth in case counts is widespread, occurring in both Western and Eastern Washington, as shown on the two graphs on the left, that have essentially become vertical during the past 2 weeks. As a reminder, the graphs on the top represent Eastern Washington data, and the graphs on the bottom represent Western Washington data. And you can see that the middle graphs, which represent total daily tests, have been nearly flat over the time period where we've seen this explosion in the number of cases. So this is not due to increased testing. This is a real increase in disease. You can see on the right, in the right-hand graphs, that hospitalizations have also been increasing on both sides of the mountains, but particularly in Western Washington. And since our case counts are accelerating, I'm afraid that our hospitalizations will soon accelerate as well and overwhelm our healthcare system. And you can start to appreciate in the Western Washington graph that it looked like hospitalizations were increasing at maybe a little slower pace than they have been more recently, but it's a little bit hard to tell at this point. So lastly, cases are rising among all age groups, which indicates that transmission is very widespread in our communities. And it also indicates that we'll see significantly more hospitalizations and eventually deaths since our older age groups are affected. So we're really at a difficult time in this pandemic. We're fatigued, and we've already made a lot of sacrifices this year, but we cannot give up. We all need to do our part to flatten the curve once again. This includes being vigilant about always wearing a mask whenever we are around people outside of our households, and strictly limiting contact with people outside of our household. Ideally, we should probably all stop socializing for the next several weeks to try to slow down the disease that's rapidly spreading through our state. But if you need to socialize, please limit your social contacts to no more than 5 people outside of your household per week, and keep your social interactions as short as possible. So I'm particularly concerned at this point about a surge in hospitalizations that would put strain on our, could put huge strain on our hospitals and overwhelm their capacity. And we're at the point that if we cannot change the current trajectory of disease by changing our behaviors, we'll need to take actions that will hurt our economy, and no one wants to do that again.